Hello, I am Dr. David Miller. I'm a GP in Edinburgh, and today we're going to be speaking about whooping cough. Whooping cough is a highly infectious bacterial infection of the airways and lungs that can often cause quite an unpleasant illness for many and a more serious illness for a few younger children and babies. Whooping cough is classically an illness that causes severe bouts of coughing. So the patient will cough and cough and cough and often have to take a whooping intake of breath, but only about 50% of people get that. What sets it apart really is that severe paroxysms and severe bouts of coughing that last a minute or two, and also the fact that it can cause quite a prolonged illness, so the cough can often last 2 to 3 months or even longer sometimes. There's 3 phases of symptoms with whooping cough. First of all, the early phase, where a patient often has sort of cold-like symptoms, so runny nose, sore throat, mild cough, possibly mild fever. This lasts 7 to 14 days. Then you get the main phase of the illness, the severe bouts of coughing, where the patient continually coughs and sometimes is sick at the end of that. Their face can turn red, their body can go rigid. And then you enter the recovery phase, where these severe spasms of coughing can still occur, but they become a bit less frequent. Well, really everyone's at risk of whooping cough in terms of contracting whooping cough. It's spread by droplets when people who are infected with the condition cough or sneeze. For most it's this unpleasant sort of illness, but it's really more the younger children and babies, especially if they're less than 6 months, that are particularly at risk of complications from whooping cough. The best thing that we can do to prevent against whooping cough is to get vaccinated. So there's 3 vaccines against whooping cough. Firstly, in pregnancy, that's given to pregnant women when they're over 16 weeks gestation of pregnancy, and that provides protection to the newborn baby for a few weeks after they're born. There's also the 6-in-1 vaccine, given at 2, 3 and 4 months to infants. And then finally there's a preschool booster. Preventing the spread of whooping cough is very important. One of the main ways we can do that, of course, is through vaccination in the first place. But if you're unlucky and become infected with whooping cough and are displaying symptoms, there's certain things you can do to prevent the spread. So basic hygiene measures, so covering your mouth and nose when you're coughing or sneezing, using a tissue to do this, washing your hands regularly too, common sense things such as wearing a face mask and keeping your distance from others where you can. The other way to prevent spread is by seeing your GP, because if your GP agrees, they may well give you antibiotics. For the most part, whooping cough can be treated at home, and most people don't become very unwell, but it is still very important to seek medical advice if you suspect you or your children have whooping cough. Also, if you have any particularly severe cough or cough lasting more than 3 weeks, prolonged breathing difficulties, shallow breathing, blue skin or lips, or pauses in the breathing. So in conclusion, whooping cough is an unpleasant condition for many and serious for a few. There is, however, things that we can do to prevent and treat this, and it's very important to remember to get your child vaccinated. It's a safe and effective vaccine. To remember basic hygiene measures such as covering your mouth and nose when you sneeze, washing your hands frequently, and also seeking medical advice should you suspect you have symptoms of whooping cough. Thank you very much for listening.